So from my standpoint, a patient who has acne and is depressed is like a reason to be on isotretinoin.
Exactly.
Because when you look at the data, overall people's quality of life improves and
Yeah.
their depression improves on isotretinoin. And probably because you know why they're depressed? Because acne causes depression and acne
Right.
causes suicidality. So treating their acne improves those symptoms. However, there are absolutely people who get idiosyncratic mood changes. And when I say idiosyncratic, I mean you can't predict them. It's not people who are depressed before. It could be anybody. And it might not be depression. They might be more irritable. They might just feel different. They might not feel themselves. And it's very rare, but it absolutely happens. And you take them off the medicine, they feel better. You put them back on, the same thing happens again. So it's something I keep an eye out for. It's something that we ask about at every visit. It's another, actually, I think, opportunity to use patient-reported outcomes. You could use something like the PHQ-2 or the PROMIS-D depression scale to screen patients in clinic for things like depression that you might be worried about. And really, any acne patient, you should be worried about that.
Yeah.
But I personally, I don't worry. Like if someone's depressed, I'm totally comfortable putting them on isotretinoin. We're gonna monitor things just like I would for any patient on isotretinoin, but it's not like a contraindication where I don't use it. Unfortunately, what sometimes happens is not necessarily that I ask for the okay, but that I get a preemptive not okay from their primary care doctor or psychiatrist because they've read some of the earlier reports about depression and aren't as up to date potentially on some of the newer studies that have shown that's not true. And that can be challenging where you just can't, no matter, you talk to them on the phone, you try to convince them, but they just won't budge. And then the patient's hearing different things from different people, and that's always, how do they know who's right? So I've had that happen. That can be really challenging where someone, you just can't clear them. You're trying your best with antibiotics, spironolactone, good topical regimen. You're trying to do everything you can. And really isotretinoin is the only thing that's gonna be strong enough to do the trick, but you can't get it to them because they're scared.
Yeah, that is a hard case.
Yeah.